Skin Sense. I'm Jeannine Mazurkiwecz, and we're here with Dr. Schleicher. We have a guest today, and we're talking about how to keep your skin looking its best, right?
Well, actually, not only that, looking its best and keeping people alive.
Right.
Because we're going to be talking about the most deadly form of skin cancer, which is malignant melanoma.
And we have a guest with us today.
Exactly. We have Katie. Katie's our new PA. And Katie, maybe you can tell us a little bit about yourself.
I graduated from King's College this past August. It was a 5-year program. I did various months of rotations in surgery, gynecology, family practice, and of course dermatology, and then I ended up here with Dr. Schleicher, so.
And you really like dermatology.
I love dermatology.
And I love the
great
school
field.
you went to. King's College is a great school to
they
be
have a
graduating
great
from.
program.
I graduated from there as well.
So when you're a PA, maybe you can tell us a little bit about your training and how many years it is, because, you know, occasionally we do get patients who, you know, their kids want to perhaps be PAs. PA is short for physician assistant. And I have to tell you that's in vogue these days. And I think with Obamacare and with the changes in healthcare in general, PAs and nurse practitioners are going to be, you know, pretty near the top when it comes to the medical profession. So again, Katie, maybe you could tell us a little bit about.
Yeah, so basically a physician assistant is a licensed healthcare provider who's able to diagnose and treat patients as long as they work underneath a supervising physician. So we're able to see patients, diagnose you, and write your prescriptions as long as we have a doctor who basically oversees what we do and signs off on what we do. But in terms of schooling, basically you go to school, you can either do a 6-year or a 5-year program. Different schools have different programs. The 4-year you would have to go and get a bachelor's degree first, and then you could apply to different PA schools. That's usually if your school doesn't have its own physician assistant program. But if the school tends to have its own program, it's basically you do your undergrad in 3 years, and then the last 2 years are just strictly physician assistant classes, and then you do your rotations. So you get on-hand patient experience basically in the 2nd year after you take all your classes in the 1st year. So you get to see different fields and see what you like and what you get the feel for.
Now, Dr. Schleicher's office is located in downtown Hazleton here in Pennsylvania, and a lot of people don't know what goes on here as far as what some of the people do that help you. So what is your role here with Dr.?
Right now I'm basically just training. You have to go through a lot of credentialing and everything after you get your license and you take your boards and you pass them. So after I get that, I can see my own patients, and then I could go over the treatments of Dr. Schleicher. As long as he agrees with me and he's okay with what I'm doing, he just signs off on basically what I was doing with the patients. But I can have my own patient base and see my own patients on my own.
Okay, and doctor, today, as you said, we're going to be talking about the deadliest form of the skin cancer, and that's melanoma.
Right, and I think it's important for everybody to recognize this form because, you know, we're talking about some 80, 90,000, perhaps even 100,000 Americans each year being diagnosed with malignant melanoma. And the nice thing about it is that it's something you can actually see. Okay, it's not like a cancer inside your body that you may need, you know, very expensive diagnostic equipment to visualize, or it may stay dormant for many, many years before you even knew you had it. With melanoma, you know, virtually all of them are on the skin surface, so people have to be aware of what it looks like. People have to be aware that moles can change, and sometimes they can change for the worse, and sometimes they become skin cancers that can actually kill you if they're neglected.
And people need to know that you should have someone at least examining your back, behind your ears, places that you really don't think of
back
looking.
of your legs, your feet.
And this is where, you know, you could really develop a serious, deadly form of skin cancer and not even know it.
Right, and the American Academy of Dermatology actually just released a clip, it's probably on their website, teaching people how to do self-examinations. And you can use a mirror or mirrors to visualize areas you can't see if you live by yourself. Or, of course, if you live with somebody else, you examine that person and he or she examines you. And again, you can save lives that way.
And you do examinations here in the office, correct?
Oh, absolutely, absolutely. And we recommend anybody with a family history of a skin cancer, certainly anybody with fair skin, with blue eyes, with blonde or red hair. Those are individuals who probably should get skin cancer examinations on a fairly routine basis, perhaps once a year, maybe even sooner if you yourself have had a skin cancer.
As they say that it's proven that smoking is bad for you, again, tanning beds are bad for you, especially when we're talking about this form of cancer.
Right, and we'll talk more about that in the upcoming segment, because there's been even some new news on skin tanning and how bad it is for you, okay, which really kind of appalled me, because I didn't realize how bad until I read this new report.
And I know you looked at me when I walked in, because we are in the colder months, but I actually have a spray tan today, so that's it's safer for you than actually using a tanning bed.
And your tan looks great. I mean, you couldn't. Jeannine looks like she just came off a plane from Florida. Okay, she looks
Darn it,
great.
I wish I did. I wish I was in the Bahamas, but no, I was actually at South Beach Glow, and I love it. I love how it. We all like to feel a little bit. It gives you that pick me up, and it's safe for your skin. And again, avoiding the ultraviolet rays, those deadly rays that get into our skin and actually can form something that is deadly.
And I think we should point out real briefly too that years ago self-tanners just weren't really cosmetically elegant, okay, and a lot of people were turned off to them. And Jeannine, I know you were very happy with where you're going, okay, and it looks really, really natural. And again, it's safe. It's made from a vegetable dye, is what the self-tanning is, and it's very easy to apply. You can either go to a shop to get it done, or of course you can buy the self-tanning in any drugstore. But a lot of it's personal preference too. Experiment, see which shade you like, see which brand you like. But yeah, it's so much safer than doing indoor tanning, which you'll see the figures next segment, and they're pretty bad. Figures are bad.
So when we come back, we're going to step inside basically a tanning bed and show you what you shouldn't be doing, because I know you're out there and you're watching and you're in your teens, or you're even in your 20s and your 30s and thinking, well, it's far away and this can't happen to me. But there are people out there who have developed skin disorders, skin diseases, and actually cancer from using tanning boots. So we're going to talk about that next. You're watching Skin Sense right here on SSP TV. We'll be right back. Welcome back to Skin Sense here on SSP TV. If you're watching in the Hazleton location, it's Service Electric Cablevision Channel 13, and in the Pottsville area, it's Comcast 7. So thanks for returning. We're talking about some forms of skin cancer, specifically malignant melanoma, and that is the deadliest form. And again, why you should not be using the tanning boots during the colder months. Although we feel better when we look a little tanner, again, spray tans or creams are the way to go to protect yourself, not only from cancer, but from the aging process.
Right, and the reason why we're doing this show is because a couple of weeks ago I received the latest edition of Sun and Skin News, and this is from the Skin Cancer Foundation. Okay, and the headlines is this: one tanning session raises melanoma risk by 20%. One tanning session. Okay, and each subsequent tanning session during that year raises your risk an additional 2%. Now, these are staggering figures, okay? Really think about it. And, all of the people out there in the audience, just think about yourself. How many do you go to tanning, indoor tanning? How many people know others who go to indoor tanning? And the same month when this came out, there was another study done from Stanford University, which showed that 1 out of 5 athletes, admit to indoor tanning during the year. And these are college athletes and these are athletes who are exposed to the sun. They picked athletes who played baseball or whatever outdoors. 1 out of 5
now,
if
we know that the statistics show that we are raising your risk 20% by one tanning boot session, how are tanning beds still available? It's just like smoking.
Excellent question.
How are they still able, and people will say that, listen, if it's that bad for me, then why am I allowed to do it by law?
Well, you know what? Same reason why people can buy cigarettes.
Yeah.
Okay,
I think it's mostly, it's an addiction, basically. Like I was just saying before, the youngest person I've ever seen with a melanoma was 18 years old, and she was a girl who went tanning all the time. It was on the back of her leg. She never really noticed it. Her mom saw it one day, told her to go to a dermatologist. It was about 7 or 8 centimeters. It was irregularly bordered and pigmented, and it was dark. We biopsied it, and it was malignant melanoma.
Yeah, and that's really tragic.
And what
when you
happens
see
then?
that.
So you removed it, obviously.
removed.
Well, it was
So-
biopsied, and then she had to go for surgery, and then they had to check her lymph nodes and everything else. So it is a really big process to have this type of skin cancer.
And so it's not like, I want the audience to know, if you're listening out there, it's not they just cut it off and it's gone. I mean, malignant melanoma, depending on how long it's there, can travel throughout your body.
Yeah, it can kill you.
Right.
Yeah, it can and it will kill you. If you neglect it, it will certainly kill you. Okay, and the hope is that you catch it early enough where you save lives. And it's certainly, you know, majority of patients with melanoma, their lives are saved, but there's a certain proportion. You know, 10,000 Americans die every year from malignant melanoma, which is tragic, and it's, you know, just as tragic that the incidence keeps increasing. And with people, you know, going indoors more often, tanning, it's going to increase even more. And for instance, last year I was in Brazil, and Brazil banned indoor tanning for the entire country. Now there are certain states in you know, the United States where you need parental consent to be able to do indoor tanning, or you may not even be able to do indoor tanning because, you know, more people are recognizing that it's a carcinogen.
So what's it going to
So-
take for us to be able to say tanning beds are closed for good?
Well, it's probably going to take a lot because, you know, in this country we're pretty laissez-faire, so we leave it up to the individual by and large to, you know, be able to figure out whether something's good for you or bad for you. So the more we talk about how bad this is for you, hopefully it will filter down so people will no longer want to do indoor tanning. We'll do what you do, okay? Get a safe spray tan.
All right, so if you're watching, you think, okay, maybe this we're serious that the tanning beds can possibly lead to some kind of problem with your skin, especially something that's deadly. This is how you look for it. There are the first, when we used to do the show back in the day, it was the ABCs, then it was the ABCDs. Now it's the ABCDEs of
Right,
the
so
signs to look for
So we have to
for
be
the
more
malignant.
intelligent. We have to know a little bit more of the alphabet.
Now we have to
as
know
we
it. I don't know if Doc
progress
can
here.
handle it. We're going to
Yeah,
try
I don't
here,
know if I can
folks.
handle. That's why I'm turning to Katie because it's getting a little too advanced for me.
All right, so-
But Katie, you can start with the A's and go through what to look for.
Okay, so basically the ABCDEs are just a little way of helping us remember a quick and easy way to check for skin cancers. So first, A stands for asymmetry, meaning if you drew an imaginary line down the middle of the molar lesion, it would look different on one side than the other. Normal moles are usually pretty symmetrical from side to side, as if malignant melanomas, they can look completely different in shape in all different ways. And then B stands for border, which means the border is usually pretty irregular or jagged looking. It's not a clear-cut circular border as in a regular mole would have. C stands for color. Usually if something's malignant melanoma or if it's some kind of cancer, it has multiple colors in it. It can have blue, red, white, brown, tan, just multiple colors. Anything that looks like that, you want to get checked out by a dermatologist. And then D stands for diameter. Anything bigger than 6 millimeters, which is about the size of a normal pencil eraser, you want to get checked out by a doctor if it has a greater diameter and exhibits anything A through C. Then E stands for evolution, which really means change. So if anything's changing in size, symmetry, color, border, or you're getting new symptoms such as cracking, bleeding, or itching, you definitely want to get it checked out by your doctor or dermatologist.
So are they adding to this because we know more about
Well,
malignant melanoma?
yeah, the last letter was E for evolving, which again means any mole that's changing. So by changing, what does that mean? Well, even if a mole starts to itch can be a very early sign that a mole is becoming cancerous. Now, there's another very important sign, too, that we talk about. It's called the ugly duckling sign, meaning if any of your moles just doesn't look like the rest of the moles that you have, that's the so-called ugly duckling.
Okay.
That's the mole you definitely want to bring to someone's attention. Because again, to find out if you have a melanoma or to find out if you have a benign lesion, you know, which fortunately the majority are, it's such an easy process. Well, Katie will tell you, it takes exactly 3 minutes for us
Yeah.
to take a little tiny sample, and then we send that out and get analyzed.
I know most people can't believe how quick it is when they come in here and they're in and out of the office in about 10 minutes with this process, and we get it analyzed by a lab, and they tell you exactly what it is so we know better how to treat it.
All right, so speaking about treating, we're going to talk more in depth about the malignant melanoma when we come back here on Skin Sense. This time we're going to be focusing more on your feet and your toes and how you can actually have skin cancer right there on the bottom of your feet. Stay with us. We are talking about the deadliest form of skin cancer today on Skin Sense, and we have another guest with us. At first, we had Christy. Now Rudy is back. She's been on Skin Sense before, so thanks for coming back on the show with us to inform and educate our viewers about malignant melanoma. We were talking in the second segment of our show about how to detect if you out there might have a malignant mole right on your body with the A, B, C, D, and E's that we look for. And it actually, moles can be deadly that are actually on your feet, your toes, the bottom of your feet. So we need to actually check all of our body parts, right?
Yes. Yeah, it's actually the most common malignant tumor on the foot. And Bob Marley died of a foot tumor, malignant melanoma. So unfortunately,
it's very easy to overlook, because how many people examine the bottom of their feet?
Right.
Or how many people, realize that something affecting their nail may not just be a little blood, broken blood blister under the nail from trauma, but could be one of the most deadly forms of cancer.
Now describe that. What will that look like on you're saying your nail bed?
Mm-hmm. Yeah, we'll show a picture exactly of what a melanoma looks like, and exactly what's called the hematoma, which is totally benign. But maybe Rudy, you could talk a little bit more about that.
So there is a very common mole that, especially in darker skinned individuals, you can have a linear line on your nail, underneath your nail. It's a darkened pigment, so it's going to be brown or black. But if it's a Caucasian or lighter skinned person, that's when you're going to be really concerned. In the fact that if they have a brown or black streak on, it's usually the thumb or the big toenail. And age ranges from 50 to 70. If you notice a change in your nail, and it doesn't have to be pigmented, because there's also amelanotic melanoma, which is not pigmented. And we have an example of that as well. But other than the thickness of the lesion, the ulceration of a lesion can be another poor sign. So just remember to check your nails, and then if the actual line or band, the brown or black band, if it widens, that's going to be something that's going to be concerning to you.
Oh, you painted a melanoma on your fingernail.
Yeah, I needed to grow one for the
okay, so that's good. So she took one for the cause here. So, but one of the points to make too with melanomas of the foot, that's a common area for black individuals, to develop a skin cancer. And skin cancer is very, very rare in blacks, because relatively the darker the skin color means the more melanin that you have, which means really the more protection you have from the sun. So nobody really associates, a black person and skin cancer. But as Rudy said, Bob Marley died of a skin cancer, melanoma of his foot, which he just basically neglected, and it spread, and that's what he died from at a very early age.
And that's the problem with the feet, is that you're not gonna find it until a later stage, and it's actually easier to treat in an early stage. So that's why you should, even if you wear nail polish, check your nails at least once or twice a year. Make sure there's not a pigment, like a brown or black band pigment, that's not getting wider. And just have your dermatologist check it, or your family doctor check it.
How often should you be going to a dermatologist if you are perfectly healthy? Should you be going once a year for a checkup?
Well, it really depends. Again, if you have a family history of skin cancer, that's the key. Or if you've spent a lot of your lifetime outdoors, and again, if you're obviously if you're a black individual, you're relatively protected. If you're a white or Caucasian individual, and especially if you're of Nordic Celtic descent, well, then you are not protected. The highest rate of skin cancer in the world is in Australia. Why? Because, Scottish people, English people migrated to Australia. The skin there is absolutely brutal. And it's the percentage of population that develops skin cancers there is staggering, staggering. So that when we see individuals who come into our office, say an individual's fair skin who comes in for acne, well, many times we'll offer that individual a complete skin exam, especially if they're in the 30 or 40, 50-year age group. They're the ones we want to target, because that's when skin cancers can first start in predisposed individuals. So again, and some people just don't realize, as guys get older, they lose their hair. So nobody really thinks about what's going on their scalp. And you know, there's an article published a few months ago about how important it is for hairdressers to actually examine their clients' scalps, because you know, really, when you think about it, I mean, you can't see your scalp.
Right.
Okay, until I lose all my hair, I'm not going to be able to see my scalp. So
Well,
hopefully,
we're getting pretty.
yeah, I know we're getting there. Thank God, thank God for Rogaine.
Thank God for being tall for Dr.
Yeah, I
Schleicher.
guess. So I'll be able to see my scalp. So, you know, I should be wearing a hat and I should be using a sunscreen when I play tennis, because, yeah, people never even imagine that their scalp can get sunburned, and we see a lot of skin cancers on people's scalps.
Now, this leads me to my other point, is that you could be, develop this, children can develop actually some forms of skin
Well, you know
cancer
what?
as well.
Fortunately, skin cancers in children are very, very rare, but when they do occur, they're very, very serious. Okay, and you do, on occasion, see sad cases of, you know, kids, you know, 12-year-olds, well, usually around early teens, who first develop skin cancer. And one of the problems we run into, you know, you get the tanning moms of the world bringing their 10-year-olds to indoor tanning, okay, which is really tragic, but it happens all the time. And we talked about the statistic. You know, you have a 20% greater risk of developing melanoma after we're talking one exposure. I mean, that's pretty amazing.
Yeah.
Pretty amazing. So that's like smoking one cigarette would increase your chance of lung cancer. Well, obviously that's not the case. But with indoor tanning, it is the case. So, you know, when you think about it, it's even more deadlier than smoking.
That statistic blows me away, that they could actually say that and people are still going out to these tanning booths and still, I mean, I get itchy when it's this time of year, it's colder, the sun isn't out as much and you feel just white and icky, but then I think to myself, you know, the consequence of going into these tanning booths can be fatal.
Yeah, and it's really kind of new. I mean, you know, back, you know, 5-6 years ago, indoor tanning was really the vogue.
Yeah.
I mean, everybody talked about it like it was the thing to do, and everybody did it. And finally, it's filtering down. You know, thank goodness, really a lot of it's from the actions of dermatologists all over the country who recognize that, you know, more younger patients were coming in with a deadly form of skin cancer. And when you took a history, you find out that a lot of these people went to indoor tanning, and, you know, people put 2 and 2 together and found out that's what was causing their skin cancer. So, you know, you don't want people to die from skin cancer. You know, you don't want them to develop it in the first place. You certainly don't want them to die from it. And that's the one skin cancer that you can die from.
Wow. Well, thank you for coming on the show today, and to Katie, our newest member here, right?
Yep.
We are growing here.
Absolutely. And for everybody, I just want you to all check your skin. Okay, do it periodically. You know, check your whatever, your sons, your daughters, your husbands, your wives' skin. If you see something that just doesn't look right, by all means get that checked out, because, you know, it may be a lifesaver.
All right. Doc, thanks for having us in. And again, you're watching Skin Sense. You're on SSP TV. We'll see you next time.